Today we'll discuss about lipoprotein metabolism. Now, why this lipoprotein metabolism is important? Because by understanding this lipoprotein metabolism, we can study the drugs which acts on this lipoprotein metabolism, or we can say we can easily understand the mechanism of action of hypolipidemic drugs. So we'll start the lipoprotein metabolism. This lipoprotein metabolism, there are three main pathways. First is the transport of dietary lipids, that is called as the exogenous pathway. Then transport of hepatic lipids, that is the endogenous pathway, and reverse cholesterol cycle, that is HDL metabolism. Means it starts with lipoprotein metabolism, it starts with transport of dietary lipids, that is called as the exogenous pathway, then transport of hepatic lipid, endogenous pathway, and lastly reverse cholesterol cycle, that is HDL metabolism. So we'll start with the transport of dietary lipids, the lipids that we taken from the diet, exogenous pathway. What happens when we took dietary lipids or dietary lipids, transport of dietary lipids? So these dietary lipids, dietary cholesterol and dietary triglycerides, mainly they are of two types, dietary cholesterol and dietary triglyceride. When we say dietary lipids, lipids means either they are cholesterol and either they are triglycerides. So transport of dietary lipids, so there are two types, dietary cholesterol and dietary triglyceride. This dietary cholesterol is directly absorbed from the proximal small intestine. Dietary cholesterol is directly absorbed from the proximal small intestine, and this dietary triglyceride, they are not directly absorbed. They are first hydrolyzed into the fatty acid and glycerol with the help of enzyme lipases. What happens to the dietary triglyceride? This dietary triglyceride, they are not absorbed directly. This dietary cholesterol, they are absorbed directly from the proximal small intestine. This dietary triglyceride, they are not absorbed directly. They are first converted into fatty acid and glycerol with the help of lipases, and then they will get absorbed in the systemic circulation. In the enterocytes, long chain fatty acids, they are incorporated into triglycerides again. What happens in enterocytes? Long chain fatty acids are again incorporated into triglycerides. Now, in enterocytes, cholesterol and triglyceride, they are packed into chylomicrons. In enterocytes, cholesterol and triglycerides are packed into chylomicrons, and these chylomicrons, they reaches to the systemic circulation, and in the systemic circulation, triglyceride content of chylomicron converted into free fatty acid with the help of vessel wall lipoprotein lipase. And this free acid or free fatty acid, they are used by the adipose tissue and the muscles. They are used by the adipose tissue and muscles. Now, from where this free fatty acid is generated or synthesized? From the triglyceride content of chylomicrons. Triglyceride content of chylomicrons is converted into free fatty acid with the help of enzyme lipoprotein lipase. This lipoprotein lipase is present in the vessel wall. They are present in the vessel wall or vascular endothelium. So this lipoprotein lipase converts triglyceride content of chylomicrons into the free fatty acid, which are used by the adipose tissue and muscles. Right? Now what happens to the remaining of chylomicrons? what happens to the remaining of chylomicrons? Chylomicron remnant. The remaining chylomicron remnant contain mostly cholesterol. It contains mostly cholesterol, and that cholesterol is removed from the blood by LDL receptor which are present on the liver, and that process requires apolipoprotein E as a ligand. Right? The remaining chylomicron remnant that mostly contains cholesterol, that chylomicron remnant which mostly contain cholesterol is rapidly removed from the blood by the LDL receptor which are present on the liver, and that process requires apolipoprotein E as a ligand. So this is called as the exogenous pathway or transport of dietary lipids. Now we'll see transport of hepatic lipid or endogenous pathway. Hepatic triglyceride and some cholesterol are packed into VLDL. Hepatic triglyceride and some cholesterol